All right. Happy Monday, ladies. It's Monday and it's the last week of January.
Yes, yes, it is.
Can
Cannot
you
believe it.
believe? Oh my gosh.
No, I know it's just going too fast. But anyway, today we have a really great topic, which I'm so thrilled about, and that's men's hormonal health, which is so important. Of course, last week, Nats, you and I had on Paul Passlage that spoke about the male perspective as a husband, as a partner. But he
Yes.
also touch in on, hormonal stuff. Okay, Paul is joining us now. He also talked a lot about, his guy friends and all of that topic. So I think this was a great intro for us to
Yes.
really get in here and have this conversation with Dr. Van Horn today because it is a touchy subject for men, which men don't generally like to talk about this stuff. But I think that the more that we talk about it, and I know for you, Dr. Van Horn, you've had a lot of more men on your, as I've seen it on social media, where you're really getting involved with the men and the discussions of testosterone and all of that. So let's get started. Welcome, Dr. Van Horn. Thank you so much again for joining us. We are super thrilled to have you on board on our team on this
Right.
discussion.
Thanks for having me, guys. It's always a pleasure. And you guys help me to kind of open up that discussion and to kind of put it out there. We talk about menopause all the time, and
Mhm.
we forget that men are also going through their thing as well, hormonally, at the same time that we are. As a matter of fact, everybody in a house that have teenagers will be all going through hormonal things. So it's a rough phase of life, really, for everybody.
It is.
And understanding what's going on, can help people be a little bit more sensitive and
Yes,
understanding.
yes, yes. Give a little grace, a little grace. Yes, yes.
Oh, I love that. Grace, yes. So,
So I think it'd be easy if you guys just answer some of the questions because
Sure.
to be honest, I did not see, I did not know. I thought he was going to be on this call today. Actually, it would have been great to have like a man to kind of dialogue with. But um, what kinds of things did he talk about, and then that can kind of lead me in because men's main hormonal decrease is testosterone. They don't have estrogen and they don't have progesterone, and but no, they don't have progesterone. But testosterone decrease also leads to their estrogen decrease as well. And so it's that off balance that leads to some of the symptoms they have. So would you like me to start talking about that?
Yeah, let's
well,
jump in. I
yeah,
mean,
because
we do have Paul listening. If Paul would like to join us, we'd love to have him, but we're not putting him under pressure. But he is listening to us. He's here, but we're not putting him under pressure. So, Paul, if you want to jump in, jump in. But
Yeah,
yes,
Paul, could just ask any question. It'd be great to have a man, like at least even just ask questions so I can like kind of direct it to a man. It would be nice.
okay.
So men have testosterone. Men have 9 to 10 times more testosterone than women, and that testosterone, when it gets metabolized, forms estrogen, just like in women. The testosterone is important for their muscle mass. It is important for their libido. The libido is important in women and men because we cannot have a human race without men and women being interested in sex. So men have they need to have that interest, right? It helps with their decrease in their anxiety. It helps with their self-esteem. It helps them come to compete with other men, to want to be competitive, to be strong, and those are the elements really of a man that helps the species to survive. So if we look at it just in terms of pure function, right? Those are some of the elements of multiplying people on Earth, right? The man in his function, and the woman just purely in terms of function to get people to be here on Earth, and for us to just continue to exist, right? Now, when the man starts to lose the testosterone, they also lose estrogen. And from a scientific point of view, losing that estrogen, which is smaller than the woman has, but it also leads to increase in heart disease, which is why men tend to have earlier heart disease than women. When that testosterone starts to go down, they lose that estrogen that we have lots of until like we get to menopause. So our Heart disease doesn't start until after 50, but men's heart disease starts before that if they're not paying attention to that decline in testosterone. So men don't want to have too much estrogen because too much estrogen is also bad for the heart, right? The men who are obese and their fat is making estrogen will also have bad effects on the heart. And then you don't want to have too low estrogen because that estrogen is going to help to make sure that there is no plaque disease in the heart. So looking at the hormone levels, right, just like in women, we look at the levels and where they are. We're looking to make sure that you're in that range at all times.
So at what
Okay.
point, so like how we as women, we say, oh, well, you start testing your hormones at, 45, 50. For a man, when does that happen for them?
So for men, it would happen for sure. I would say after age 40, it should be a part of their annual exam.
Really?
Uh, But as I think I mentioned before, I'm seeing this more and more in men and women earlier and earlier. So it really should depend on your symptoms, right?
Mm-hmm.
You're a
Mm-hmm.
man and you're depressed and you're taking antidepressants and you are seeing nothing happen, or you're a man and you're in the gym and you're lifting some heavy weights and you're still soft, like all over, or you have this like belly that you can't get rid of, and you're eating perfect and you're doing everything that you should be doing and it just doesn't make sense, and you're not interested in sex, or it doesn't bother you that your wife not giving you any sex. Those are things that should stir up a little. I wonder if everything's okay,
Mm.
right? Because it does bother men when women are not interested in sex, right? They tend to be the ones who are irritating you and saying like, why you don't want to give me a piece, right? If a man is not getting sex and he's just going, okay, that's not a problem, and he just got to his bed and he's like not bothered, that's not normal either, right? So it because men have so much testosterone, like for the women who have been optimized with testosterone, when they get the testosterone and they start getting interested in sex, it's just kind of like, whoa, I understand the problem that men have, because you can feel that effect, of the hormone coming back in your body, right?
Mm-hmm.
Men lose that naturally. It's easy to write off that it's work. It's easy to write off that your wife is miserable. It's easy to write off that the children giving you problems, traffic thing, whatever, all the different things. But it, again, with men, it may just be that your hormone levels are going low.
Interesting, interesting.
Yeah.
And we're talking a lot about testosterone, but are there other hormonal imbalances that men should be aware of? I mean, cortisol.
Yes, just like in women, your adrenaline levels and your cortisol levels are going to suppress the testosterone, right?
Okay.
So we do want to, well, we can't really test adrenaline levels except like through urine accurately. Cortisol, we do have some salivary tests and some urine tests that can kind of give you an idea of like where your cortisol levels are. If they're
Mm-hmm.
way too high, then that could be suppressing your testosterone. And then the corollary of that is if you're in burnout and your cortisol levels are in the ground, then that means that you've already burned through your cortisol and you're in a bad place now, that you've already burnt down your testosterone and your cortisol levels are also exceedingly low. So those can give you like kind of ideas. However, if you do your cortisol levels and they are normal, um, it, it doesn't mean that something is not wrong, because cortisol levels are best checked if you have a 24-hour urine, just like with the adrenaline levels, right?
Right, right.
So sometimes those results can be normal in the people who are in the middle range. But if you're at extremes, right, like burnout or your cortisol levels are sky high, then we can catch those people. DHEA is what the dihydroepiandrosterone, or DHEA, is what forms testosterone in your adrenal gland. So men make it in two places, as we do. They make it in the testes, in their scrotum, and they make it in the adrenal glands. If you check DHEA levels and you find out that that is low, that's a huge indicator that you are in a set of burnout or you're not producing testosterone for whatever reason, because DHEA is the precursor to testosterone. So it would let us know as physicians, and healthcare practitioners, that if your DHEA levels are low, you don't have what it takes to make the testosterone level, right? And just like in women, vitamin D is really a pro-hormone. You need vitamin D for your immune system. You need vitamin D for your energy. Vitamin D interacts with all these other hormones. You want to know that your vitamin D is optimized. You want to know that your vitamin B12 and all your B vitamins are all optimized, because vitamin B12 it helps for your hormones to get in and out of cells, and ions in general just get in and out of cells, minerals to get in and out of cells. So you want your vitamin B12 to be optimized. And yeah, I mean, those are the things that I personally check on a yearly basis, right? And then the sequela from those things being out of whack would be your hemoglobin A1C would be up, your tendency to be a diabetic is going to go up if your testosterone is not optimized, because testosterone helps your insulin sensitivity.
Mm.
If it's not optimized, then you're going to have lower HDL, which is your good cholesterol that keeps your plaque down in the arteries. So that is going to be low. And your LDL, your bad cholesterol, is going to be up, right? So it throws off that balance in men and in women. You're going to lose that protective effect of your testosterone. And if your testosterone is down, your estrogen is also down in men, and you lose that protective effect again from the estrogen on your heart, right? So men have that as well, right? So we want to look at all of that on a yearly basis. And if, let's say, there are a lot of men who I do check and they're not in the bad range. So your bad range would be 500 or less with symptoms, right?
Mm-hmm.
300 and less, you definitely need to be treated. 500, 400, I want to know, in the health assessment, what are the symptoms that you're having, right? And if you're having a lot of symptoms in the moderate severe, then that also lends itself to somebody needing to be treated.
Mm-hmm.
I get a lot
Mm-hmm.
of men who are like 700 and they have a couple things here and there, but they don't have, they're not where they should be in terms of like the under 400. Those men, we just watch. You watch them year after year and look out for the symptoms, right? Some men are going to have symptoms at a level of low 500. Some men are going to have symptoms at about 400 nanograms per deciliter. All men are going to have symptoms at 300 and less, right? In some way, shape, or form. The normal range that we want men to be at is 900 to 1200. That is where your 18-year-old boys are at like 1200 and sometimes over. That is the best time of their life, right? In terms of energy, in terms of being interested in sex. Sometimes they get erections for no reason at all. It's totally
Mm-hmm.
normal, right? Because that's just what the testosterone is doing. And then by the late 20s, it's downhill from there. The men are starting to lose at 1% a year, right? And then the more stress that you have, then the faster that you're losing it. So the men that I tend to see more often than not are your firefighters, your policemen, your men in the military, right? As a matter of fact, in the military, they test that every year because they know their men going to war are under profound stress, right?
Yeah.
So this is how much we know that testosterone is affected, and it can affect you cognitively first in the man, right? So whereas with a woman, it might be more mood. Not to say that it doesn't affect the men's mood, but it's a cognitive thing with men. Can't focus, can't get the thing, memory's bad. And then they might be more irritable, yes.
So
Mm.
before we go on, you know what I think from this, and that is also for women as well, is when we talk about our normal levels, what's normal. And of course, when we do these tests, it doesn't show up as abnormal or whatever in the tests, because I think for women, we've had this on our shows in the past. But I think stating that number again, the 900 to 1200 for, for everybody watching the replay or whatever, look at those numbers, because when you do get the test and you go to your doctor and they say, but everything is normal, you're in the normal range, they're just gonna go on home and think right
Something's
off the
wrong.
bat.
What is wrong with me? So it's kind of like I mean, I don't think this has been done on purpose, but through this putting that as a normal range for men and women, that normal range, which is not normal for you to feel your best, it kind of like it sets us up as doctors to gaslight you, right? Because
Right.
you're there saying You know, you look at the health assessment. I'm exhausted, it's severe. My sleep problems, severe. I'm irritable, that's moderate. I don't have any zest for life. You put me on the antidepressant and anti-anxiety pill, I still don't feel anything. And then where's the doctors are going, but everything is okay. But no, everything is not okay because your level, a 900 is where all men are going to do well. Most men are going to start, some men are going to start falling off at about 500. Some men are going to start falling off only at 400. So this is why it's very important to see people as an individual, right? Because not everybody is going to have the same number and feel the same, right? So for us here as women, like you guys have a basic understanding of like where I want your testosterone levels. If you come into me and you have a 45 and you say that I have lots of energy. I don't have any mood problems. I like to have sex. That's not a problem for me. I am moist in my vagina. Then I'm not, even though your number's off, I'm not going to try to give you hormonal balance because you're doing fine at that level. But most women are not going to do well at that level. And that's what is happening. And most of us are not doing well at the levels that they say are normal.
That's scary.
Yes,
It's
so we're
scary.
trying to get them to change it at the level, but that takes time, right?
Mhm.
Because we've been in this like rut of disinformation for a little bit.
Yeah.
Um,
Well, it's like
Oh, wait, hold
with other
on, Nats. I
subject.
think Paul has a, sorry, Nats. I think Paul
Oh,
has a,
sure.
go ahead,
Hi,
Paul.
Go ahead.
I'm sorry about that.
Okay.
Dr. Van Horne, you just said something about the if your numbers are at a particular level and you're feeling good, right?
Yes.
But what about the other factors which you spoke about earlier? For example, your good cholesterol, bad cholesterol. Suppose those numbers are also off, but you are so-called feeling good, or you
Great.
assume that you're great, yeah, or you're feeling good. But
And your
those are
testosterone
also,
levels are low, and your testosterone
yes,
levels are low.
yes, and those numbers are also off.
Right. So it's just not about just how you feel. Yes, I'm also looking at that. Right. I'm looking at you've been trying to take off weight and you can't take it off. I'm looking at your cholesterol is off and you're beginning to see. I'm seeing signs now of your insulin sensitivity being off. There are
Mhm.
two ways that you can go about it. And one way that we can go about it is the way that we've been doing in medicine for a while. Give it a metformin, give you medicine for the cholesterol, give you medicine for whatever.
Mhm.
Or the other corollary to that, especially for people who don't want to take a lot of medicines or they just don't have the discipline to do that, is to balance their hormones, give them that energy to work out more, give them the hormonal balance so those things will be alleviated. That discussion in medicine just has not been there, right? Because we know that is happening, that hormonal change is happening. Why not attack the hormonal change so that we don't have to have people on all of these medicines, right? Um, so we
Mhm.
have two ways of going about medicine, right? And that's what's kind of happening.
Okay. Well, thanks, Paul, for that question. I think it's a great question.
Yeah.
Yeah. Nat, sorry, I interrupted you. Go ahead.
Oh, it was actually to Dr. Van Horn's point about what is normal, because I think even with other blood tests to do with other levels, we have to recognize that normal means what most of the population is experiencing, and most of the population is not healthy. Like most of the population is not optimal. So
Right.
I don't want to be normal. I want to be optimal. And
Right.
I want my levels to be at levels that function optimally, you know.
Right.
And I think that's where that was to your point about the gaslighting. So I think the more we get into, you know, working with integrative practitioners such as yourself, that's understanding the whole picture, that's
Right.
where we begin to see that what that blood test tells is within normal range may
Right.
not always be what we're targeting.
Right. And
Yeah.
normal, when they did these tests to figure out like who was normal, where did these people come from? Were they living in Scandinavia? Were they living in Japan? Was it a Japanese study? Where were these people? I mean, if
Yeah.
they are in Scandinavia, their lifestyle is not going to be the same as an American. And if it's American people, were they white American? Were they black American? So
Right.
you really have to see people, I say all that to say you have to see people as individuals, because it was a Japanese study that was done, you cannot necessarily say that that normal is for everyone, right? And what happens sometimes in medicine is that we just don't have the studies, and so we have no choice but to try to just extend it. But when you realize that, okay, at under 500, most men are really kind of like not wanting to get out of their bed, and I have to have them all on antidepressants, or we have to have all of them on diabetic medicines, then we should ask that question. And the same with women, right? And when I, as a doctor, start practicing like that, and I start seeing that I'm taking people off antidepressants, and I'm taking people off of their cholesterol medicines, and I'm taking you off of your blood pressure medicines, then that starts to really ring alarms in me, like to go, what have we been doing, right?
Yeah.
But it's a fight, right? It's a fight because, the hormone tests are not covered, I gather, in Jamaica, and here in the States, they are covered. You don't get the copay, you have a higher copay for the hormone testing, which I really don't understand, like, why that is happening. I don't want to be a conspiracy theorist, but if it is that we can see that we're taking off all of these medicines off of people, and it's making it hard for people to figure out what their hormones are, making it expensive for people to get the treatment, then that seems like you want us to
You wonder what's up, right?
Yeah.
You wonder what's up.
Well, for me, having this discussion about, especially for men, is, we talk about, for men, it's a tricky subject because, they talk about their performance.
Yes.
And when they see it as they're not performing, they don't want to deal with what has to be done. So even for me, when I was starting, it was more about what I like to call the big boys of your heart, your organs, and all of these important things. How can we raise more awareness for men to it not be about, performance, but it being more about protect your heart, protect your bones, protect your, that. And also, of course, increasing your testosterone to have better libido and all of those things. How can we do that?
Well, I mean, the only thing I can think of is that we can, like, talk more. The more I talk to men, though, is the more I realize, like, how important their sexuality is to them. Even when they get to be like 80 and 90, that essence of being a man, and their sexual, thing. Especially women, because we don't have that much testosterone, it's just hard for us to understand. That's what really gets their attention, right? This is what I'm realizing. But I think if more and more doctors, and it's more out there in the manosphere, right, talking about what happens when you get to 70 and 80 and you fall, that men are having fractures, and that leads to them being in nursing homes, and that leads to them, that long-term thinking, right? If you protect your hormone levels, then you won't have that heart attack when you're like in your 50s, right? I think that just requires a change in how we are talking, right? For the men who are in nursing homes, who don't know who they are, they don't remember who yes, there is an aspect of Alzheimer's, but not everybody has Alzheimer's. A lot of them just had low testosterone from when they were in their late 40s.
Wow.
By the time their 60s, their memory is that bad. And then by the time they get to 70 and 80, they don't remember anybody at all. It is a hormonal thing, right?
Wow.
And the amount of nursing homes that we have here in Florida, 60% of that is women. And that is because we don't have as much testosterone as men. So the hormone thing is a huge deal. It's a huge, right? And it's a huge deal for men. And men, they, once they get alerted to the fact that it is your cognition that starts to get attacked first. If we could get men to just like realize that when you start to lose your memory and you have to start writing things down every minute, and you can't remember people's names who you've been seeing for from 10 years, or them from prep school and high school, or you hang out with them. When those things start to happen, then it's not just age, it is checking, right?
I have a question about the hormone replacement for men and contraindications, right?
Mm-hmm.
So just like with women, we talk about safety and because we're balancing out quality of life with if there are any negative side effects. What
Right.
are some reasons? So if a man tests, he's having symptoms, he tests, he needs the hormonal support. What are some reasons that it would not be advisable
Right. So
for a
when
man?
we check the test, we also check men's PSA levels, right? Because we want to
Okay.
check that the prostate is okay, right?
Okay.
You cannot give testosterone to a man who has active prostate cancer, right?
Okay.
So that is a hard no. Now, speaking about prostate cancer, that tends to be men's fears along that side of prostate cancer. So just like with breast cancer, if you start to pick up where the fall is beginning rather than let the fall happen, right, into the low T level,
Hmm.
what studies are showing is that you can actually offset the onset of prostate cancer, right? Because just like with the breast, if you let what is setting up prostate cancer is the deficiency of testosterone to begin with,
Could
right?
you say that again, please?
Yes. So when the decrease happens in the testosterone, that is what is actually setting up the prostate cancer to begin with. If we just have our testosterone levels go like this all through into our 70s, let's say, we would not have the kind of prostate cancer that we're having now. And this is what the studies are showing. So the fears that we had regarding prostate cancer and even breast cancer can also be dealt with hormonally. Because if we don't let the testosterone drop down, even for us as women, right, when it starts to happen in our 40s, if we get the testosterone levels to stay above a certain amount, we
Hmm.
will have also the kind of breast cancer. The breast and the prostate are corollaries of each other,
Hmm.
right? So now, when a man gets to be in his 50s, 60s, we have to check the prostate. And if you have symptoms of, because that, by that point now, the cat is out of the bag, right? If the drop has already happened. So we have to check the prostate to make sure that that is not an issue. The PSA levels, and if it's very, very low, then that gives us an indication that you don't have any symptoms of what we call prostatism, which is like having to run to the bathroom, having to push and force to get the urine out through the penis, those kinds of things we want to know, right? And for men whose PSA levels are above a certain amount, we will have them go to a urologist, have them palpate the prostate, and just make sure that there's nothing that's there. If those things are all normal, you are free to get testosterone, bioidentical.
Right.
Now, if
Okay.
you have, you may not have prostate cancer, but what you may have is BPH, right, which is a prostatic hyperplasia. It's benign, but the prostate is enlarged. For those men, when there's another way to give testosterone, and that is synthetically with your injections and with your patches. There are testosterone patches for men. However, the synthetic testosterone activates the BPH. And what can happen is that the prostate can get so big that it cuts off their ability to urinate and can set up
Mm.
problems. So you really need to know about the prostate, the status of the prostate. The difference now between bioidentical
Hmm.
and the synthetic ones is that the bioidentical does not stimulate the BPH like that. So if you have an enlarged prostate and you get bioidentical, it's not going to stimulate because it's your natural testosterone again, right? So it's not going to stimulate the prostate like that, right? To cut off your urination completely. But the synthetic ones have that potential. So where with women, where we, when you come in, like we're asking about like, how many pregnancies and your periods and if you're clotting and where you are close to menopause, fibroids, all that history in men, it's the prostate that we really want to know about, right?
Hmm. Hmm.
It level gives us quite a bit of a an idea. Just like with women, there are also other, I don't think we had discussed this too much, but there are other things that we wouldn't want to give you testosterone. Well, But we want to make sure that your estrogen levels aren't going to be like over the top. Things like if you've had a meningioma in the brain, and like multiple myeloma, right? We need to make sure that you're not somebody who's going to make too much estrogen from the testosterone. So there's a bit of internal medicine that happens at that level. It's not just you need the hormone, so that's why we ask all of your past medical history, all your past surgical
Right.
history, all needs to be done. And if there are a lot of places, certainly here in the States, where you can get these injections and they don't do that kind of thorough history. If that's happening, then you don't want to be at a place like that, because a
Right.
very thorough medical history has to be done, because hormones really are interacting with every single organ on your body, right? And you need
Right.
somebody who understands that.
Okay.
So you're talking
So
about the synthetic hormone. Sorry, Nat.
no, go ahead.
The injection. I mean, I've heard so many things about the testosterone injections, and of course it's synthetic, but it's also what, oil-based or something, and it can affect
Yes.
your cholesterol and your heart and all that. Talk a little bit about that.
Yes, so there are different ways that you can get testosterone. We have the patches for men. They have patches for men, but they don't have any patches for women, just to stick that there. But anyway, there's patches for men, which are synthetic, right? And they have gels for men, which are also synthetic. Some of those are covered by certain insurances up here in the States. They are synthetic, and because of that synthetic, they have an oil base, because to get through the skin, you have to have a certain oil-based constituent, see, for men. Then with the injections, those are definitely suspended in an oil-based product that goes intramuscularly. Initially, that's not going to pose a problem, that oil-based constituency. But when you're doing that over 3 years now, introducing oil into your system, that is going to flip that LDL and HDL ratio, where you're going to have lower good cholesterol and a higher bad cholesterol. So yes, you are going to get those symptoms of higher libido, feeling better about life, feeling motivated. If you have headaches, yes, those are going to go away. If you're having anger management problems, or irritable with everybody and short with everybody, your memory could get better. But long term, you can't be on that, past 3 years. Just like women can't be on these estrogen pills and these birth control pills for too long either. The other thing with the synthetic medicines is not just that the lipids are going to increase, but that your plaque artery issues are going to increase. So the bad rap that we got from testosterone really came from the athletes who wanted to have stronger muscles and run faster and flip fast and do all of those things, and they would start testosterone early in their life. And then you find that by the 30s now, they're having heart attacks, they're dropping down to sudden deaths. Those are from either heart attacks or from blood clots, right? And so that is where the bad rap with respect to synthetic hormones came from, right? Because after 3 years of doing that, those risks are there, right? So whether you're in your 20s or whether you're in your 40s, that risk is going to be there. But certainly it is going to help with the symptoms. For men, the creams don't really work, because men you have to be getting to levels of 900 to 1200. So the testosterone creams don't really work with men. They need an actual patch that is just there giving off that synthetic testosterone all the time. And then you have the pellets, which is what I do. And the pellets are going to be giving off testosterone at a slow pace. They're bioidentical, and that is going to be diffusing into your system over at least a 5-month period. Older men who are not doing too much, maybe doing like a golf, they're home most of the time, they tend to last like 6 months, right? But in general, again, for men, it's going to be twice a year that they right? For whatever other men are going to be listening to this, or the women who are listening to this who have never done pellets, it comes from soy or yam, and the molecule is identical to what the men get. Now, when we do give you these things, the onus is on us to make sure that your cholesterol, etc., is fine, right? So for men who are getting the testosterone, certainly the synthetic, they should be checking their cholesterol twice a year. But the other thing that needs to be done very, very frequently with men, definitely twice a year, is to check their blood count, because some men will produce blood cells more than others, right? Red blood cells, right? And their red blood cell count will go up. Now, it's if the red blood cell count goes up too much, sometimes you can get headaches with that amount of red blood cells in your system.
Okay.
What I ask men to do, if they look like they're going to be that kind of person, is just to donate blood. There's so many people who need blood. It's not pathological. It's not going to do anything bad, but the headaches and is really the worst thing, right? So we do have to keep an eye on your red blood cell count, and then we have to keep a check as well now on your estrogen to figure out which men are going to be men who produce more estrogen than others. For those who produce more estrogen than others, we kind of have to go a little bit on the leaner side with the testosterone and on the heavier side with the testosterone, because if you have too much estrogen, you can get the man boobs. The scrotum can shrink, and men are very sensitive about those kinds of things. And they can get a little bit more teary and a little bit more emotional, like women. Like, so you're watching a movie and it's sensitive, and then they start to cry, and men don't like that, right? So yes, we are checking in all of those things. When we give the testosterone, not just put it into you and then you're gone. Like, we want to see how you're metabolizing that. Now, that kind of thing doesn't necessarily happen with the synthetic, because you're not producing the good estrogen from the synthetic, right? So there are differences there.
Okay.
Wow.
Yeah.
When we go on this, whether men or women, when we go on this type of hormonal support, is it something that we are going to be doing for the rest of our life?
Well, you don't have to do it. I guess that the quick answer is you don't have to do it, because for all of us who are doing hormones right now, I mean, for me, I'll use myself as an example. Sometimes I get myself so busy, I forget that I do pellets, and I forget that I need my pellets. And I have to actually go back to the chart to see, when did I do my pellets the last time, because I'm kind of acting a little off, right? And then I will realize, oh, that's why you're acting like this, because it's been a while. You're not going to die. It's just that you're going to be the way you were before you had pellets.
Right. Okay.
Now, some people straight up don't make as much of the hormones as other people. Some people get run down with their hormones more than others, because their lifestyles are my lifestyle is extremely stressful, right? I like the kind of stress that I have in the terms of, like, I just work hard, right? I go hard. There's some people who work out hard, right? I'm not going to tell people to not work out as hard so you don't burn out your pellets, right? Like, they like that. Like, that's stress on the body, but it's a good stress, right? So yes, I mean, the short answer is yes, it is something that you're not going to be able to produce that, right?
Okay.
You're just not going to be able to produce it. And if you don't produce it, then you're going to need it. Now, my oldest patient, she's going to be 99 soon. And because she still does things, she wants to go and play bridge with the girls. She wants to go and do her volunteer work. She still goes out and does stuff. She's a retired police officer. She's always getting invited to things with the boys, right? And they like to show her she's 99 and she was one of them, and da 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 da. And if she didn't have the testosterone, she would be in her bed.
Yeah.
And so, does she need the testosterone? No, she doesn't need the testosterone, but she would be in her bed. And that's what she was for months. And then no, so she doesn't miss with it, right? So it just depends on
How much life you want to live.
Exactly.
Right.
The quality of life you want to live too.
Yeah.
Exactly.
Yeah.
So for some women, they can deal with exhaustion, they can deal with everything else, and they don't have any sex drive, and it's affecting their marriage because their husband is like, either like, if you're not going to sleep with me, I'm going to sleep with other people. Like, those are real conversations in marriages. Or it starts to affect the marriage because the man starts getting irritable because they need sex, right? They have way more testosterone. You have your little 45 testosterone, and he has 700, 800. He's not going to be happy, right? So these are real conversations for real life situations, right? And do you want to live like that, right? So some women have major dryness. Do you want to be dry, like, and you can't walk in peace, right? So these are real conversations. And then there, for the men, a lot of men who are considered low testosterone don't actually have problems with ejaculation or libido. But if you are CEO for a company and it takes you an hour to just turn on the computer and like check through like 3 emails, that's going to be a problem. Right? So it affects your work quality. It affects your productivity. It affects a lot of things, So, people just have to kind of weigh those things for themselves. And then, like most things, it's a journey. And then they decide. Like, some people need to be sharp at certain points than others. And so I have some patients who, because of the cost of the pellets, they may do it. They work it out, and they work out when they want to get the pellets done, because these are certain times that they want to be sharp. They want to have this not be kind of slow. So everybody just has to kind of work that out for themselves, right?
For sure.
Yeah.
What about we talk about pellets, we talk about patches and stuff. Are there any, for the men who are resistant to doing treatment, what about natural or lifestyle changes to
Yeah.
boost that? Is there such a thing?
Yes. I mean, you want to decrease the rate at which you're going to be losing testosterone. So just like with women, well, first of all, you can take DHEA as a supplement, right? But DHEA is going to be your precursor to making testosterone, right? So if you live a very stressful lifestyle, you may want to do the DHEA and get things going that way. For a lot of men, it is not happening at that level. It's happening at the level of the scrotum. And in that regard, the DHEA might not really work, right? You won't know until you try it. So there's that. Sleeping is very important to your immune system. That is how that when you sleep, your T cells, your white cells get a boost. So it helps from an immune standpoint, but also your testosterone and stuff, it gets to resurge because your adrenaline goes down, your cortisol goes down when you're actively sleeping. So you need to sleep, have proper sleep. The proper problem is that testosterone deficiency leads to insomnia. So that's a struggle. So there's the testosterone, there's sleeping, and then there's getting out in nature, right? These very simple things: getting sunlight, being around trees, being around a pet, playing with the pets, playing with the kids. These very simple things, like these are the function of us as a tribe, right? Those things are also important for men. There's one thing I forgot to mention, because we do have men who are on the younger side who are having low testosterone. When you do start the testosterone, your sperm count can decrease, right? So most of the men who I encounter are men who they've completed their families, and right, but you do have the odd time where I have to have the conversation with men. Have you completed your family? Because you have not completed your family, it could be that your sperm count decreases. So if they're actively trying to have a family, then they shouldn't engage in either bioidentical or synthetic hormones, because that's going to suppress their natural ability to produce testosterone on their own, and B, it's going to suppress the sperm count.
Okay.
If you stop doing synthetic or bioidentical testosterone, you go back to square one, but it takes about 6 to 9 months, right?
Okay.
So for some men, they are low T from, for whatever reason, and they need, some of them have had, like, let's take your medical reasons. You've had a brain tumor that controls the testosterone down below, and you remove that tumor, and you no longer get stimulation of the scrotum. That's one where you need it regardless of sperm count or anything, right? Or you are born with a hormonal deficiency that your testosterone just doesn't, your scrotum just doesn't produce the testosterone. those men have a low sperm count. They're probably not going to have children anyway, right? So those men who are younger, they can get testosterone. They will need testosterone. And if they don't, then depression is coming for them, obesity is coming for them. They can't think. People might think that they have autism, or that's how bad the brain is, right?
Right.
But for all the
Wow.
other men in between, right, who have low T because they've had a poor diet with lots of preservatives, or some of you men who went to war, they have to grapple with this, right? Some of those men I do see. Yes, you're in your late 30s, you haven't completed your family yet, and here's your testosterone in the tanks, and you can't work, right? So that's a difficult conversation to have, right? And for ones who are up here, what we ask them to do is go to a sperm bank, put the sperm, get your sperm in case it becomes a problem. Then you have your sperm
We
there.
have sperm bank in Jamaica too, you know.
Hey, oh God,
Yeah, man.
falling self. Okay. Well then,
Yep.
go to your
Yep.
sperm bank, put your sperm in, because if your testosterone is low, having kids is going to be an issue, right? So usually those
Okay.
men, I don't pellet them. I let them go to a urologist, have them
Mm-hmm.
talk about like all of that stuff, sperm bank, all of that kind of thing.
Okay.
Yeah.
We found, anecdotally, of course, we found that there are certain herbs that help.
Yes.
Whether or not it's placebo effect or it actually is, a real situation. But there's Tangat Ali, which a
Mm.
lot of our men swear by. Um,
Okay.
Shilajit also helps.
Yes.
It
Yes.
helps, and yeah. So, and then there's the horny goat
Ashwagandha.
weed. Hmm?
Yes. Horny goat weed and
Yeah,
ashwagandha. Yes.
ashwagandha as well. And I think ashwagandha helps predominantly because it helps to regulate the cortisol levels,
Yes.
and therefore allows the natural testosterone to flourish.
Yes.
Yeah,
So those are all things that you can do, right?
yeah.
Once you get to like the 300 level, 250.
You're probably out of the range of
Yes.
natural.
Yeah. So I think what men can do is maintain with those. Like when you're
Yeah.
in when you do your levels, and you see that you're 700. Nobody's going to give you. Well, I wouldn't certainly treat somebody who's at a 700, right?
Hmm.
But that's when you would intervene now with those things. So,
Right. So sort of
yeah.
like a first layer of attack.
Exactly. To make the decline smaller over the years.
Yes.
Yeah.
Okay.
Wow, some good stuff. But I think it's again to have that conversation with, I loved how you talk about having the conversation with your partner, because it goes
Yeah.
both ways. If for a woman who has been pelleted and she's feeling fabulous and
Yes.
he's not,
Yes.
it works both ways. So I think it's
Hmm.
important for women as well. If you see your partners different, maybe as Dr. Van Horn said, not interested or whatever, is to have that conversation that maybe it could be perhaps that, because for women it's important. We talk about with each other because we don't have a problem, but it's important to have the conversation with your partner that,
It is.
hey, I'm seeing something here. Could we, let's talk about it.
Yes.
Hmm.
So what I love about this setting is that women are already invested, like listening to this. However, women probably will be the first line of defense for their men, right? Because
Absolutely.
they open their eyes, and
Yeah.
men will take the baton. They may not, some of them might even act like they're not even like listening to you, but they are, and they'll go and research it. And there's tons of research, and there's tons of men talking about it. Just like with the menopause woman, there are lots of um, doctors and men talking about like what they do, right? So it's out there that that this is something that is happening to men. And to be honest, for urologists, this is something that they do talk to men about, right? A little bit more. They may not actively treat it, right? Or offer testosterone in that interim, but they will at least have that discussion with men, because when men have libido problems, it's a problem. Yeah.
Nobody's happy.
Nobody's happy. But Paul, I'm very interested. Is there anything that I have not addressed with respect to men, that you think that I should be asked, or is
Uh,
it clear? Yes.
no, I mean, I've learned a lot today.
Great, great. Yeah.
Yeah. About just
Same.
remind me, you're saying the testosterone level for men
Mhm.
at what stage again? You're looking at what?
So your
400 or
norm,
less?
so where men feel their best, right? In terms of motivation, in terms of memory, in terms of sexual stuff, in terms of having energy and motivation, etc. Want to do more in the gym, 900 to 1200. Like if men could stay there, and that is where men were in their 20s.
Okay.
Um, where it is that now we start to consider treating a man is when you get to like the low 500s. 400s, we're definitely having that talk. 300 and less, that where I'm definitely saying that this is something you need to do something about, or you're going to see real, if it already isn't happening, real life metabolic issues are going to be happening, and we have a short space to counter it now. Yeah.
Oh, okay. Because what I've noticed from the conversation, um, most of the things that you have said,
Yeah.
I think I exhibit probably 90% of what you have spoke about.
Right.
So it is obvious that we need to have a talk.
Yes. So, and then also to say, I don't want women to even think or go telling their husband that they're low testosterone either, just because they have all of these things, because there are thyroid issues that can mimic this.
Mhm.
And sometimes depression in of itself can also mimic this. So to be honest, for this, those things that I've just discussed, most men, when I check, it is a testosterone thing that is happening. For some men, most men don't tend to have thyroid issues, but you pick up the odd amount that have thyroid as well. So that's why it's just good to check in, which a lot of men don't even do. They don't do the blood work once a year, right? They a lot of men just say, "Oh, I'm okay. If I'll go and see a doctor when I feel sick, and I don't feel sick, right?" And some of these things they ignore. But it doesn't necessarily have to be testosterone.
Mhm.
You, Paul, are clearly a very good patient, right? You're like actively seeking the information, but some men are actually afraid of hearing the bad news. Like they're
Yeah.
petrified. Like, I have men whose blood pressure go to like 190 just being in my presence, because they don't want to hear what I'm going to say. They don't want to hear anything bad. They don't want to hear anything's wrong. I guess women go through that a lot because we always have to go in for pap smear. So we might hear that our pap smear off. Then we have to go and check the baby. And then you might hear where the baby turned around wrong, or the baby this or the baby that, or what. We're always in a state
Yeah, we're
of,
always checking things.
Yeah,
right,
mammograms, everything.
mammogram,
Absolutely.
right? But men don't have that. So you see, when they get to this stage, women just have to be very, I would say for some women, if you know your man is like that, just come to the doctor with him, because that is a thing that is in men. They really don't want to hear that something is wrong, right?
Mhm.
Because they want to feel like they have everything under control. And when your health goes, then that they feel like they're out of control, right? So if you know that your husband is like that, just have some grace and just come, because they may not remember, A, because the testosterone is low, and B, because they don't want to hear anything is wrong.
Yeah. Yeah.
I
Yeah.
think
Yeah.
I think what is interesting is the I guess the relation or correlation with the testosterone and the uh, prostate or
Yeah.
prostate cancer, whatever. I think that is kind of interesting, and I think that is probably something that would probably drive men out more to really look at that. I didn't know this before,
Absolutely.
so I think
Yeah.
that's a very
That
important
is
and
that is new developments that's happening, that really is
yes.
also going to require a change in the culture of medicine, because there are also us doctors who grew up just like with this menopause thing, who grew up hearing, oh my God, testosterone is going to make you get prostate cancer. But no, what we're really finding is that it is the dip that starts to make the prostate cells act off. This is Dr. Morgan Thaler from Harvard who started doing the research, And it's out there. He's been trying to change the culture. He's having a lot of pushback from it. You know, for whatever reason, but that is really what is really showing. And then not only that, that once men also have had prostate cancer, and if they have surgically removed it, just like with breast cancer, 5 years after, you are free to do bioidentical hormone replacement therapy, which that also, you know, we have to kind of change the conversation with that. So there's a lot of room for where medicine has to kind of catch up to where the research is, because a lot of that is fear. And once you get the fear, it's hard to change or behavior, even us as doctors, right? Because, you know, look at it from a doctor standpoint, we just don't want to do anything wrong. And sometimes when new research comes out, we go, is this legit real, or is it going to change again, right? Like, so it takes a while for us to see more and more and more research until it's like, okay, there's enough research here now. It's undeniable that this is what's going on. So that's why the change in behavior takes time.
Yeah, and being able to speak to the right person. I mean, again, when we talk to our GPs and they're not trained in it, they know nothing about it, they're not going to give you any joy, if you will. So, like we would tell with our ladies, you keep research, you keep talking, you keep finding, going to talk to the doctors that are going to give you the answers. And I think it applies to men as well. That,
Right.
you know, go to an internist that maybe know a little more in depth rather than your GP. Go and talk to, you know, just find somebody rather than, oh, your GP says, oh no, you're fine.
You're fine.
And
Yeah.
remember, we are in a generation where that aspect of medicine is where the change is happening. And change happens the way as soon as everybody really kind of gets on board, right? And that just takes time, because we do have some doctors who are giving pushback, who are fearful, who want to see more evidence and stuff. And then you have the doctors who are looking at the evidence, and we're going ahead. Like I guess I'm in that category. So other doctors will come on board once they are comfortable that yes, okay, this okay, I see, or their own patients. For me, it was a patient who came to me and said, like, you know, you weren't on board with me, so I went and did my thing, and I was going through the same symptoms, and I was like, let me look at this research, like for real, right? So sometimes if your ego is not too out there, my ego is not too out there, I was okay with my patient going, I had to do this thing that you weren't offering, because whatever, can you you talk to the people and see if everything is okay, but I couldn't take feeling like this anymore, right? And that patient taught me a lot. And to be honest, even when I give you guys the books that I gave out at the conference, that OB-GYN, it was a patient who taught him as well, right? So sometimes our patients teach us, you know, and that's what medicine is, really. It is hypothesis, and you test the hypothesis and you do the research, and that's what good medicine is, right?
Thanks so much. So what I'm hearing is if our men are experiencing symptoms of low testosterone, which can be cognitive, drive, both drive for life as well as sexual drive, depression, obesity, muscle mass not quite where it should be, belly getting a little bigger than normal, depression setting in, and a lack of interest in sex. It's a good idea to go and get those hormone levels checked.
And let me give you two headaches, right?
Headaches.
Increasing for no reason. And men get night sweats or hot flashes. They get it because their estrogen level, that's how I know now a man's estrogen level is really, really low, because they get hot flashes because their estrogen goes too low.
Gotcha. Okay. So then we would test, and then men feel their best when their ranges are between 900 and 1200. If they're dipping down towards 700, they could try natural support. But if they get down into the 500s, we really have to start looking at other avenues. And if they're below 300, now we're going to run into real challenges with metabolic syndrome type issues.
Yes.
Okay.
Yes.
Phenomenal information.
When you're lower than 300, that any doctor is going to say, yeah, we have to do something about it. So you need
Yeah.
a urologist to be like, okay, let me check your prostate because we have to treat you. It's
Right.
the
Okay.
part where men are still struggling, right? 300 to 500, where they
Mhm.
don't feel well, that, all of that stuff, where different doctors will give you different approaches or just tell you you're just getting old, like women. Yeah.
This has been an amazing discussion. Natalie, I love your
Yeah.
cliff notes. I love, love, love your cliff notes. How about you just print that out, send me a picture of it so I can put it in the replay email as well.
I will. I
That's
will.
All right, guys. Thanks for having me again.
Thank you
oh, always a
so much.
treat. And thank you, Paul, for dropping in here and
Yes,
sharing
Paul.
with
Thank you
us.
so much. That helped a lot.
It's
Yeah.
always my
And
pleasure.
thanks, Trudy, for joining.
Yes, and Trudy, of course.
And
This
I'll
is
be
a
back
great discussion.
at the end of February, Paul. So just reach out, okay?
I'll
We'll make
send you
sure.
I'll send you something as I get off this call.
Okay. All right. All right,
Awesome.
All
guys.
Love
right.
you
Take care,
guys. Have
everyone.
a
Thank
great day.
you.
Have a
Alrighty.
good
Bye.
Bye
You too.
bye.
Bye.
Bye.